Vitamin D deficiency is quite common, but it's entirely preventable if looked for and treated with vitamin D supplementation. And in the UK, it's increasingly recognized as a common problem, mostly because we don't have very much sunlight, which, as I've said, is the main source of vitamin D. But I looked at a specific group of patients, and I found that a lot of them are also likely to be vitamin D deficient. So these patients are those with glycogen storage disease type 2, or GSD2 for short. This is becoming better understood since it was first described in the 1930s, and it is an inherited metabolic condition in which there is a mutation in the gene for alpha-glucosidase, and this is an enzyme which breaks down glycogen within muscle cells. So when this is deficient, glycogen builds up, and this causes effects on muscles. Mainly a clinical picture of a proximal muscle weakness, but this can range quite a lot, and this is an example of the spectrum. Okay. Mainly the treatment at the moment is enzyme replacement therapy, some physiotherapy and exercises, and possibly a high protein and low carbohydrate diet. Later in the disease, the breathing muscles may also be involved, and ventilatory support can be used then. So in 2006, there was a study in children with GSD2, and it found that in this group of 14, there was an increased risk of hip fractures. And similarly, studies on adults have found that the bone mineral density of these patients are likely to be reduced. So I proposed in my study that I would find similarly in my adult population that these patients would be more vitamin D deficient. The mechanism is not quite understood, but it could be related to the fact that they already have a proximal myopathy. So like I said, I studied 33 patients, and this was a retrospective study in which I reviewed the notes, looking at the blood markers for vitamin D, as well as the bone density scans, DEXA scans. And I devised a score for disease progression and noted any additional risk factors which might lead them to having vitamin D deficiencies, such as immobility, skin color, and other things like that. And then I used statistics to compare them to a group of healthy white adults, which was taken from a similar study of UK adults. So having analyzed that, I found that my population was indeed more deficient than the normal group. You can see that the healthy cohort, only 5 of them lied in that below 10, whereas 42.9% of mine did. And similarly, on the histogram, most of my patients lied in the insufficient and deficient levels. I also found that only 3 bone mineral density scans were completed in the department, so it was not actively looked for.